Hello all and welcome to this YouTube session. The topic is joints. I'm Dr. Ankit Khandelwal. Let's discuss the topic. This is my YouTube channel, name of which is Anatomy Explained. You can also follow me on my various Facebook pages and groups, and also on Unacademy. I teach live on Unacademy in the NEET PG platform. Let's start the topic of joints. So first of all, what is the purpose of the joint? As we can see, the purpose of joint is twofold. One, which we all know, is mainly the movement of the body parts. Second, very important, is about the growth of the bones. Yes, growth of the bones also by help of a joint, we will see. So these are two purposes of the joint. Now let us see how are the joints classified. So here we are seeing that joints are classified on two main parameters. One is on the amount of the movement which a joint produces, but second is the structure which is present between the bones which are forming the joint. So these are two parameters on which the joint is classified. On the amount of movement, the joints are classified into synarthrosis, amphiarthrosis and diarthrosis. As we all know, the word syn means fusion. So in this, the joints are actually fused, and here their mobility is very less, or it is normally immobile. In place of it, the second, amphiarthrosis, here the joints are slightly mobile, while in the third part, that is the diarthrosis, the joints are freely mobile. So this was one sort of classification on the amount of the movement. The second classification is based on the structures that is present between the bones that are forming the joint. So on this basis, which is more commonly used, joints are classified into fibrous variety, cartilaginous variety, or the synovial variety. Now fibrous means that between the two bones there is a dense fibrous tissue. There is a thin layer of dense fibrous tissue. Cartilaginous means between the two bones or the bones there is cartilage. Now that cartilage normally is hyaline cartilage, or it can be hyaline and fibrocartilage. Normally elastic does not play a role because elastic doesn't provide that much of stability. Third one is a synovial joint. Now as the word synovial means that this joint over here between the bones, it will have synovial fluid, it will have synovial membrane. The mobility will be quite enhanced in this category. So in this parameter, the joints are classified into mainly three parts: fibrous, cartilaginous, synovial. We'll see one by one. Let us move to the fibrous joints. Now fibrous joints themselves are classified into three other varieties. What are those? One is sutures, one is gomphosis, one is syndesmosis. Now sutures, we all know, we are all very familiar. Sutures are present in the skull, we'll see them. Gomphosis is for the tooth and the socket, the gums over there, and syndesmosis we'll see. Syndesmosis is by far the best example of fibrous joint, that also we'll see. So we have now seen that joints are classified into two main parameters, and one parameter was about the structure present, and there is this fibrous. Now fibrous, there are few varieties. Let us see a skull. Now you are seeing a sutures over here, and in this left lateral view of the skull, you are seeing sutures which are a type of fibrous. So there are various sutures. Now all these skull bones, they are joined by various sutures. Here we can see few bones like a frontal, a parietal bone, a temporal bone, a greater wing of sphenoid bone, an occipital bone. All of them are joined by various sutures. Now sutures are further classified. For example, let us see a couple of examples. This parieto-occipital suture is an example of denticulate suture. This petrotemporal suture is an example of squamous variety of suture. The sagittal suture between the two parietal bones is an example of your serrated suture. So there are various sub-examples of sutures, but understand the sutures are dense fibrous tissue are present between the bones, and obviously they are not mobile. Now second over here with the classification of sutures is the scintillations. Now what is scintillations? Scintillations is a category which is formed inside the suture. Now here the bone are joined in a ridge and a groove manner. For example, there is a ridge of a bone over here. The sphenoid bone forms a ridge. It fits into a groove formed by the vomer bone. So it is also known as a ridge and groove sort of joint. Ridge and groove sort of joints, scintillations, and it falls under the suture classification. Then after suture we have the gomphosis. Here we can see the tooth and the socket. The third variety, if you remember, was syndesmosis. Now syndesmosis is a very good example of fibrous joint. Here we are seeing two bones like a tibia and a fibula over here, which are joined by an interosseous membrane. That interosseous membrane is a fibrous tissue. So a very good example of a true fibrous joint. This is the interosseous membrane. This is also seen in case of radius and ulna also. While in this image we can see that the lower part of these two bones, the inferior tibiofibular joint, that is also an example of syndesmosis. I repeat, inferior tibiofibular joint. So these are the varieties of the fibrous joint. Now let us move to the cartilaginous. The cartilaginous joints are again classified into two main varieties. What are those? A primary and a secondary. Primary cartilaginous is also known as synchondrosis. Syn, again, syn means fusion of the cartilages. Secondary cartilaginous joint is also known as a symphysis. Let us see both of them, what are the various differences between them. Just for the beginning, understand, it is a cartilaginous joint, so between the two bones there is a cartilaginous tissue. As already said, it can be either hyaline or it can be hyaline and fibrocartilage. Now in case of primary cartilaginous joints, that cartilage is normally a hyaline cartilage. While in case of secondary cartilaginous joint, that cartilage is hyaline and it can also be a piece of fibrocartilage, can also be there in between the hyaline cartilage. So that we will see. Now let's start with the primary or synchondrosis. Now what we are seeing over here? We are seeing the development of a bone. This is known as endochondral ossification. Now in this you can see the bone length was this, and suddenly slowly the bone length when the child gains the age is attaining the mature adult age. So now understand, the growth of the bone is shown by the arrows over here. Now how is the bone growing? There is an epiphysis below, between you have a diaphysis or the shaft. In between you have an epiphyseal plate or a growth plate. Now this mind is made up of the cartilage. This mind is made up of a cartilage. Therefore, this sort of joint is known as synchondrosis. Synchondrosis. Now why we call it as synchondrosis? Understand, because this cartilage, later on it fuses, it forms a complete bone. So after the bone achieves an adult age, you don't see a cartilage. In a X-ray, in a opaque shadow, you see its radio opacity. There is no cartilage then. So therefore, synchondrosis, the cartilage fuse and they become bone. So this synchondrosis, it becomes a synostosis. So this sort of joint, synchondrosis or a primary cartilaginous joint, is basically a temporary sort of joint, because later on it has to fuse, it has to form a complete bone over here. That is synostosis. So this was an example of primary cartilaginous. There are other examples also we'll see. Now here is a thoracic cage. Here also we are seeing some of the primary and a few secondary also. Now here two primary cartilaginous joints we will visualize. What are those? You are seeing the ribs, the 12 pair of ribs, the sternum and the vertebrae behind. Now in the ribs are not attached to the sternum directly. There is a cartilage between them. So it is known as costal cartilage. Costal means the rib, and the cartilage of the rib is known as costal cartilage. The joint between the cartilage and its rib, that is known as costochondral joint. This is an example of primary cartilaginous joint. So what is this joint? Costochondral joint. It says costochondral joint. This is an example of primary cartilaginous. One more very good example over here, as you can see at the top over here, where the first rib cartilage joins with the sternum. Which part of sternum? Manubrium sternum. It forms a primary cartilaginous joint. So this is known as a first sternochondral joint. So what is this? This is first sterno, this is sternum, that is chondro, first sternochondral joint. So writing over here, the first sternochondral joint, that is a primary cartilaginous. The other sternochondral joints are synovial over here. Let's see the symphysis also right over here, the secondary cartilaginous. Normally the secondary cartilaginous joints are lying in the midline of the body. I repeat, the secondary cartilaginous joint normally lie in the midline of the body. Here you see the midline, manubriosternal, a ziphisternal, intervertebral disc. All these are few examples of secondary cartilaginous. Other one more common is the pubic symphysis between the two hip bones. That is also secondary cartilaginous. Understand the difference? In primary we had only the hyaline, in secondary we have hyaline and fibro in between. Here the third category is now the synovial joint. Now synovial joint, if you remember, depending on the structure between the bones, that parameter third was synovial. What is synovial over here? Again you have two bones, a bone A and a bone B. What is between the bones? Between the bones, first of all understand the few features of synovial. Synovial membrane is there, a synovial fluid is there. Now see, this joint is quite mobile. Synovial varieties are mobile joints. So therefore, it is covered by a capsule. This outside there is whole capsule. Inside the capsule, the pink color is basically the synovial membrane, and it secretes a fluid known as synovial fluid, which lies between the two bones. But here you can see the bones, the bone ends which are forming the joint are slightly bluish in color. These are known as the articular cartilage. They are basically our articular cartilage, which are also again hyaline. So in between the bones, the joint space, synovial fluid produced by synovial membrane. Therefore, the name is synovial joint. Now, are synovial joints classified into different varieties? Obviously, yes. Synovial joints are classified on the basis of axis of movement provided by the joint, or the shape of the articular surfaces which are forming the joint. Now, depending on the axis of movement, the synovial joints are classified either they don't move any particular axis, or they move in only one axis, two axis, or multi-axis. So non-axial, uniaxial, biaxial and multi-axial. Other variety was on the shape of the articular surface. There's a whole lot of classification over here. Right from plane joints to ball and socket joints. In between this whole range, the mobility is increasing in this direction. From plane, then you have the pivot, then you have the hinge, then you have the condyloid, then you have the ellipsoid, saddle, and ball and socket. All these few varieties. Let us see each example. Here's the example of the plane joint. Plane joint is shape of the articular surfaces. The two bones are normally plane. Acromioclavicular joint, example of plane type of synovial joint. Here's an example of pivot. Pivot means rotation. Here you can see the dance of the axis fits into the atlas, guarded behind by this ligament. Pivot joint, rotation, there's no movement. Atlantoaxial joint. Hinge joint, the elbow joint, the humeral, there's a humerus, that is a humeral ulnar joint is a variety of hinge joint. Movement is flexion extension. And the variety over here, what is this? Condyloid. The condyles of the head of the metacarpal over here. Condyles of the head of the metacarpal fits into the base of the proximal phalanx. What is this joint? Metacarpophalangeal joint. Example of condyloid variety. This is a condyloid variety. Okay. Then moving from here, ellipsoid variety. The radiocarpal joint over here, the wrist joint. This is the lower end of radius, that is the carpal scaphoid lunate. This is triquetral. This is forming a wrist joint. That is a variety of ellipsoid, depending on the shape of the articular surfaces. Remember, depending on these shapes. Then we have the saddle variety. Saddle variety, you can see the shape over here. But which joint is this? This is between the metacarpal of the thumb, that is the first metacarpal over here, and the carpal. Which carpal? Trapezium. So it is the first what? Carpo-metacarpal joint. Saddle variety. Movement is increasing as we are going from plane to pivot to hinge to condyloid, ellipsoid, saddle. The movement, the range of movement is increasing. We'll see. Lastly, we have the ball and socket, very famous joints. The ball of the head of the femur fits into the socket of the acetabular. Ball and socket joint. And the common example is the shoulder, that also we have seen previously. So these are the few classifications. Now we know, if we repeat again, depending on the classification of the synovial joint, depending on the axis, these were the classifications. Depending on the structure presented, these were the classifications. But are they both classification correlated? Yes. How? Like this. When we talk about the non-axial movement, mainly the plane joints fall under that category. We have seen an example. Which example? We have seen an example of the joint between our two plane bones, like acromioclavicular, the other bones also. And then uniaxial. Uniaxial particularly, the pivot and the hinge, they move only in one axis. Pivot, vertical axis, and hinge, transverse axis, only one axis they will move. So either flexion extension only will occur. Biaxial, they move in two axes. The condyloid, the ellipsoid, they do deflection, extension, adduction, abduction. They move in normally two axes. And also saddle. Now saddle variety is more than two axes, but not fully multi-axial. So it is slightly more than biaxial. The saddle variety over here is slightly more than biaxial. Finally, multi-axial, we all know ball and socket. You may have seen the ballers, balling ball, this whole circumflexion movement. You can flex your shoulder, extend it, abduct it, adduct it, you will rotate it, you will do the whole circumflexion. That is the whole multi-axial that falls under ball and socket. Okay, so I think this video is helpful for you. Follow me more on Unacademy. I teach live over there. And if you like the lecture, kindly like and subscribe to the YouTube channel. Thank you for it.